Many people notice that their knees feel stiff or uncomfortable when they first wake up in the morning. Standing up from the bed may feel slower than it used to, and the first few steps of the day can sometimes bring a feeling of tightness or mild pain in the joints. This experience is very common, especially for adults over the age of 50 or 60. After several hours of sleep, the body has remained in a relatively still position, and the joints are not yet fully prepared for movement. During the night, the knee joints stay inactive for long periods of time. Because of this, circulation around the joint becomes slower, and the natural lubricating fluid inside the knee does not move as freely. This fluid, known as synovial fluid, normally helps the joint move smoothly and comfortably. When the body has been still for many hours, the joint may feel stiff until movement begins again. Another reason morning knee discomfort occurs is that the muscles surrounding the knee can gradually weaken with age. The quadriceps in the front of the thigh and the hamstrings at the back of the leg both play an important role in supporting the knee joint. When these muscles lose strength or flexibility, the knee joint must handle more pressure during simple activities such as walking, climbing stairs, or standing up from a chair. The good news is that gentle morning movement can help improve how the knees feel throughout the day. Light exercises can increase circulation, stimulate joint lubrication, and activate the muscles that stabilize the knee. Even a short routine of simple movements can help the knees feel more flexible and prepared for daily activities. In this video, we will go through 5 gentle exercises that can help reduce stiffness and support healthier knee movement. These exercises are simple, low impact, and suitable for beginners. By practicing them regularly, you may notice your knees feeling more comfortable and stable as you start your day. The first exercise is called the seated knee extension. This is a gentle movement that helps activate the muscles around the knee without placing heavy pressure on the joint. It is especially useful in the morning because it slowly wakes up the quadriceps, the large muscles located at the front of the thigh. These muscles play an important role in supporting and stabilizing the knee during daily movements such as walking, standing, and climbing stairs. To begin this exercise, sit comfortably on a sturdy chair with your back straight and both feet resting flat on the floor. Make sure the chair is stable and positioned on a surface where it will not slide. Place your hands lightly on the sides of the chair to maintain balance and keep your upper body relaxed. Start by slowly lifting one foot off the floor while keeping your knee bent at first. Then gently extend your lower leg forward until the knee becomes almost straight. Try not to lock the knee completely. Hold the leg in this extended position for about 3 to 5 seconds. During this moment, you may feel the muscles at the front of the thigh gently tightening as they work to support the leg. After holding the position briefly, slowly lower your foot back down to the floor in a controlled motion. Avoid dropping the leg quickly, because moving slowly allows the muscles to remain active and helps protect the joint. Repeat this movement about 10 to 12 times with the same leg and then switch to the other side. While performing the exercise, remember to breathe normally and keep your movements smooth and relaxed. The goal is not speed, but gentle muscle activation. Regular practice of seated knee extensions can help strengthen the muscles that support the knee joint. Over time, stronger quadriceps can reduce stress on the knee, improve stability, and make everyday activities such as standing up or walking feel easier and more comfortable. The second exercise is called heel slides. This is a simple and gentle movement that helps improve the flexibility of the knee joint. Heel slides are especially helpful for reducing stiffness that many people experience in the morning. Because the exercise is performed while lying down, it places very little pressure on the knee while still encouraging the joint to move through a comfortable range of motion. To begin this exercise, lie comfortably on your back on a bed, yoga mat, or any soft surface. Keep both legs extended straight in front of you and allow your arms to rest naturally at your sides. Make sure your body feels relaxed before you start the movement. The goal of this exercise is to slowly bend and straighten the knee while keeping the motion smooth and controlled. Start by slowly sliding the heel of one foot toward your body. As the heel moves closer, your knee will naturally begin to bend. Continue sliding your foot along the surface until your knee is bent as far as it feels comfortable. There is no need to force the movement. The key is to stay within a range that feels gentle and pain-free. Once you reach the comfortable bending point, pause briefly for 1 or 2 seconds. This short pause allows the muscles and joint to adapt to the movement. After that, Slowly slide your heel back down the surface until your leg becomes straight again. Try to keep the motion steady and controlled as you extend the leg. Repeat this movement about 10 to 15 times with the same leg. After finishing one side, switch to the other leg and perform the same number of repetitions. Heel slides help improve knee mobility by gently increasing the joint's range of motion. Regular practice can help reduce stiffness, support joint lubrication, and make everyday movements such as walking, bending, or climbing stairs feel smoother and more comfortable throughout the day. The third exercise is called the straight leg raise. This movement is widely used in physical therapy because it helps strengthen the muscles that support the knee without placing too much pressure on the joint itself. Strengthening these muscles is important because they help stabilize the knee during everyday movements such as walking, standing, and climbing stairs. To begin this exercise, lie comfortably on your back on a bed, yoga mat, or any flat and supportive surface. Bend one knee so that the foot of that leg rests flat on the floor. Keep the other leg extended straight in front of you. This position helps stabilize your body while allowing the working leg to move safely. Once you are in position, slowly tighten the muscles of the straight leg. Then gently lift that leg upward to about 12 to 18 inches off the ground. Try to keep the leg straight throughout the movement and avoid bending the knee. The motion should be slow and controlled so the muscles can fully engage. When the leg reaches the lifted position, hold it there for about 3 to 5 seconds. During this time, you may feel the muscles in the front of your thigh working to support the leg. This is the quadriceps muscle group, which plays a key role in protecting and stabilizing the knee joint. After holding briefly, slowly lower the leg back down to the starting position. Avoid letting the leg drop quickly. Lowering the leg in a controlled way helps maintain muscle engagement and improves the effectiveness of the exercise. Repeat this movement 10 to 12 times with the same leg. Once you complete the repetitions, switch to the other leg and perform the same number of lifts. Practicing straight leg raises regularly can help improve muscle strength and knee stability. Stronger thigh muscles reduce stress on the knee joint, which may help decrease discomfort and make everyday activities such as walking or standing feel easier and more comfortable. The fourth exercise focuses on stretching the hamstrings, which are the muscles located along the back of the thigh. These muscles play an important role in supporting the knee joint during movements such as walking, bending, and standing up. When the hamstrings become tight, they can place additional strain on the knee joint. This tension may contribute to discomfort or stiffness, especially in the morning. Gentle stretching can help reduce that pressure and improve overall flexibility. To begin this exercise, lie comfortably on your back on a bed, yoga mat, or another soft surface. Keep one leg extended flat on the ground while the other leg will perform the stretch. Make sure your head, shoulders, and back remain relaxed throughout the movement. Slowly lift one leg upward while keeping the knee as straight as possible. As you raise the leg, place both hands behind the thigh or gently hold the back of your leg for support. If reaching the leg feels difficult, you may also use a towel or exercise strap looped under your foot to help hold the position. Continue lifting the leg until you feel a gentle stretch along the back of the thigh. The stretch should feel comfortable and mild, never sharp or painful. Once you reach a comfortable position, hold the stretch for about 15 to 20 seconds. During this time, breathe slowly and allow the muscles to relax. After holding the stretch, slowly lower the leg back down to the floor. Take a brief moment to relax before repeating the stretch again. Perform this stretch 3 to 5 times with the same leg, then switch to the other side and repeat the same steps. Regular hamstring stretching can help improve flexibility and reduce tension around the knee joint. When the muscles behind the thigh become more flexible, the knee can move more smoothly and comfortably. Over time, this simple stretch may help decrease morning stiffness and support better mobility throughout the day. The fifth exercise is called the sit-to-stand movement. This is one of the most practical and functional exercises for strengthening the muscles that support the knees. It closely mimics a movement that people perform many times throughout the day, standing up from a chair. Practicing this exercise can help improve leg strength, balance, and overall stability, all of which are important for maintaining independence and preventing falls. To begin, sit on a sturdy chair with your back straight and your feet flat on the floor. Position your feet about hip-width apart so that your body feels stable and balanced. Your knees should be bent naturally, and your arms can rest on your thighs or extend slightly forward for balance. Start the movement by gently leaning your upper body slightly forward. This shift in weight helps prepare your legs to support your body. Slowly press your feet into the floor and begin to stand up using the strength of your legs. Try to move smoothly and avoid pushing off too strongly with your hands unless you need additional support. Once you reach a fully standing position, pause briefly for 1 or 2 seconds. Keep your posture upright and your shoulders relaxed, then slowly lower yourself back down into the chair in a controlled manner. The lowering phase is just as important as standing up because it helps strengthen the muscles while maintaining control of the movement. Repeat this exercise 8 to 10 times at a comfortable pace. If the movement feels easy, you can gradually increase the number of repetitions as your strength improves. The sit-to-stand exercise strengthens several important muscle groups, including the quadriceps, hamstrings, and glute muscles. These muscles work together to support the knees and stabilize the lower body during everyday activities. With regular practice, this exercise can make simple movements like getting out of a chair, walking, or climbing stairs feel easier and more comfortable. It also helps improve balance and confidence when moving throughout the day. These 5 gentle exercises are designed to help your knees move more comfortably at the start of the day. Morning stiffness is something many people experience, especially as the body ages. When joints remain still for several hours during sleep, it is normal for them to feel tight when movement begins. Simple exercises like the ones you practiced today can help activate the muscles around the knee and improve circulation to the joint. By moving the knees through a gentle range of motion, these exercises help stimulate joint lubrication and gradually warm up the surrounding muscles. Stronger muscles in the thighs and hips provide better support for the knee joint, which can reduce stress during everyday activities such as walking, standing, and climbing stairs. The key is consistency. These movements are most effective when practiced regularly, even if it is only for a few minutes each morning. Over time, small daily habits can make a noticeable difference in flexibility, comfort, and confidence in movement. Remember to move slowly and stay within a range that feels comfortable for your body. If any movement causes sharp pain, it is important to stop and rest. With regular practice, these simple exercises may help your knees feel looser, stronger, and more prepared for the day ahead. Thank you for joining this routine today, and take care of your joints.